So first of all, I would like to ask you for your permission to use this conversation for internet publishing and for educational purpose. Do I have your permission?
Yeah.
Excellent. Now I understand that we had a back surgery for other problem, but now today we are talking about your SI joint. Now, can you tell me what your symptoms were before the surgery 7 months ago, and what you could and what you could not do regarding your SI joint?
I was in a lot of pain and I could barely walk.
Okay. And I remember we did the back surgery and you got better for a while, and then you got worse after we found out that your SI joint is the problem, and we did the tests and so on, and we find out that you have problem actually on both sides, in both of your SI joint, on right and left, but your problem was worse on the right side. Is that correct?
Yeah.
And then we decided to do the surgery about 7 months ago.
Yeah.
Now, can you tell me a little about how you have been since the surgery?
It's taken a while to heal, but it's healing good and I'm able to get out and do odd jobs and walk farther.
So your activity is significantly improving.
Yeah, I can ride my bike too.
And here are the pictures I'm going to show of your surgery. We see two screws in different angles. We see the screws in the right place, and here are some other pictures that show again that the screws are going into your SI joint on the right side. And at that time we talked about that many people, when they get this surgery on one side, they feel good enough that they want to hold off on the surgery on the other side. Now, you just told me, why don't you tell me with your words, what do you think, what should we do about the other side, or overall, how do you feel?
I think it should wait because I'm able to walk good and get out and do things.
So you have been improving enough that you think that you can live this way actually, and we should actually hold off and just observe the other side clinically. Is that correct?
Yeah.
Okay, and that's a fantastic, information that you feel good enough that you think you can just now hold off and just observe you clinically. Well, thank you so much for the interview.